Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop Osgood Schlatter disease pain. But before I do that, I will explain what is that disease, the causes, the risk factors, the symptoms, and the normal healing cycle, and how to address the root cause of the problem and relieve your pain at home. What Osgood Schlatter's disease? It's actually inflammation in the patella tendon, and you can see it in here in this image. The patella tendon attached from the patella, which is the kneecap here, and going down to the tibial tuberosity right in here. And it's basically inflammation of that tendon plus ossification, which means overgrowth of bone or scarring of the bone, fibrosis in the bone. And you can see it in this image. Inflammation, you start to see those redness and swelling and scarring in the bone, and it start to build up on those. So this is the front of the knee. You have the kneecap right here, the patella, and you have the patella ligaments, and some people call it the patella tendon, but the technical correct name is patella ligament, because the ligament attach bone to bone, tendon attach bone to muscle. So by definition, it's inflammation in this tendon. Also, you start to have calcification right here by the tibial tuberosity. You see this screw that usually where the tibial tuberosity attach here, the front of the knee. And some of those, and a lot of those patients actually, they start to have a scarring, fibrosis around this area, and visually they can see the inflammation, the swelling, the bone is sticking out in this area, and the inflammation of the ligament. Typically, you will experience dull aching pain, especially when you extend your knee. This is flexion. When you extend your knee or you do squatting or any sports activity, dull aching pain in this area. So what are the causes and risk factors? One of the main cause or risk factor is growth spurt for girls and boys around age 10 to 12 for girls, and for boys 12 to 14. And that's typically happen if adolescents have poor body mechanics with the sports, or they overtrain. That's a very common risk factors. Also, it could happen for adult in relation to sports injury, and that's happened because there is a muscular imbalance in the knee. One of the common causes is muscular imbalance. So it's very common you have this issue if you have imbalance between the IT band, and especially tightness in the IT band, tightness in the hamstring, that actually cause overstress the quad muscle to work harder to compensate for the tightness of the IT band on the side and the hamstring in the back. So the other risk factor or causes could be lupus, rheumatoid arthritis, or arthritis in the knee. And also, if someone is diabetic, that's a risk factor to develop this issue. So how to treat the root cause of Osgood Schlatter disease? In order to answer this question, we need to understand the normal healing cycle, and based on that, the treatment will make a lot of sense how to get rid of the Osgood Schlatter disease or relieve the symptoms you might be experiencing. So I'm gonna use external paper cut for visualization, but this is a normal healing cycle that happens internally in the knee. We don't see it because the skin covered it. So the first stage of healing is inflammation, swelling, redness. The blood starts to rush to that area. And actually, that's actually one of the definitions of Osgood Schlatter is inflammation in the ligament. And you can see it here in this image, inflammation, swelling around the kneecap and the tibial tuberosity here. So there's a significant inflammation in that disease. And also the second stage of healing, it's called the proliferation stage. That's when the body starts to build the scar tissue. You can see it here in the open cut. The scarring is actually covered the wound. This is very essential part of our survival. We need to have a scar tissue. So when you have internal damage, you need to have a scar tissue. If you don't have a scar tissue, it's open wound, susceptible for infection, and the damage will never heal. The problem is when you have too much scar tissue, and that's called hardening of the tissue or fibrosis. And in relationship to Osgood Schlatter, you can see the hardening in the bone, and that's called calcification or asphylication, and that's increasing the formation of the bone in this area and cause more inflammation, the scarring, and pulling on the knee and cause more pain. So for us, perfect scenario, actually during the maturation stage, the body should get rid of the inflammation, the scarring, and clear up like that image in the last image here, and that could take days, weeks, months, or years. As we get older, this process of healing decreases significantly, the speed of this process. But the problem with Osgood Schlatter is there is a constant inflammation and proliferation happening back to back that causing that vicious cycle. And you can see it here. Inflammation, proliferation, that's the definition of Osgood Schlatter. That's inflammation, proliferation, which is scarring in the ligament, and scarring here in the tibial tuberosity, plus inflammation of the ligament. So how to treat the root cause of the problem? So in order to do that, we need to actually break that vicious cycle from both ends. We need to decrease the inflammation. We need to clear up the scarring. And actually with the scarring or in the proliferation state, there is a cascade of events happen: fascial restrictions, muscle spasm, trigger points. We'll touch base on that in the next few slides. So that's basically to treat the root cause of the problem. I'm gonna go over common treatment that been used but's not effective, and we're gonna relate that to the normal healing cycle because it will make a lot of sense why this treatment does not work, so you don't have to waste your time on it. And actually some of these actually could cause more problem and more inflammation, more scarring, more symptoms, actually make it worse. So one of the common things that use heat, ice, and steam, based on the studies, provide temporary pain relief, and it does not really do much for the proliferation stage, and it's very it has a very minor effect on the inflammation. So it's basically masking the symptoms. The other thing that commonly used, foam roller and massage, and I will combine that together because based on the study, it's actually either provide temporary pain relief or no pain relief. And when we go over the fascia system, it will make a lot of sense why foam roller and massage are not effective at all to treat Osgood Schlatter. So for massage and foam roller, think about this way. You already have inflammation and you keep rubbing on the inflamed area. That will inflame it more, which actually gonna cause more scar tissue and make those vicious cycle worse. So that's why massage and foam roller could be actually make it worse. We need to break the scar tissue, but we need to break it on the right time in relationship to the inflammation. The other thing that's commonly used is stretching, and I personally do not recommend it to my patient because based on a study, actually stretching causes more inflammation. And think about this way, you already have scarring and tightness in the muscle. The muscle should act like a rubber band. So you have the scar tissue, it's like a knot in a rubber band. If you overstretch, you actually could cause more inflammation. And based on the study, is not effective to provide pain relief, and actually overstretching will cause more inflammation, more scar tissue. That's why I don't recommend stretching in general to my patient. The other thing that's been used is exercises, but when we look at the normal healing cycle, exercises, if you exercise while you have inflammation, you're gonna inflame it more. We need to do exercises, but we need to do it on the right time in relationship to the inflammation and proliferation. And better than exercises, what I personally do with my patient is functional training. like gait training, sit to stand, squatting. That's more effective than just doing quad sets or exercise that's not transition to function training. And actually, based on a study, function training is much more effective than just the exercises isolating the muscles. So what should we do at home? Well, basically, we need to address the healing cycle from both ends, the inflammation stage and the proliferation stage. So for inflammation, the first thing, you need to really stop the activity that aggravated, which, like if you are involved in the sports that require a lot of jumping or squatting, I will refrain from that, so to give it time to heal. The second thing, and what I personally use, is I give my patient the Magna Heal Pro to use it to wear it throughout the day or the night to decrease inflammation. This magnet is very strong. When we measured the magnetic field, it was around 3 inches, so it can penetrate the body 3 inches depth, so it will decrease the inflammation. So we need to really address the inflammation because that's part of the disease. The other thing that I usually do with all of my patients, put them on anti-inflammatory diet, because there is certain food that actually cause internal inflammation and slow down the healing. So it's more important to do the Magna Heal because there is a lot localized inflammation, and also with the diet will help the body to recover faster and actually move faster from inflammation to proliferation to maturation. Lastly, if you have a vitamins and mineral deficiency, that could slow down your healing process. So one of the things you can do actually right now, you can go to askastr.com. It's a free online medical evaluation. The software will help you. It will take about 5 minutes to answer the question, and the software will guide you about possible vitamins and mineral deficiency that slow down your healing, because you need several vitamins and minerals for your body to transition smoothly from inflammation stage to proliferation stage to maturation stage. The other thing we have to work on simultaneously, because that's part of the problem with Osgood Schlatter, is the proliferation stage, the scarring. So for the proliferation stage, we need to work on the scar tissue, the fascial section trigger point. So what I personally do in relationship to the inflammation, so first I will decrease the inflammation, and then after that I use the A3 to break the superficial scar tissue. And with the A5, I go deep to release the trigger point and break the deep adhesion. And as I said, it's relationship to the inflammation stage. So there is a certain protocol, and I go over that in the self-home treatment program, how to do that so you don't cause more inflammation. And one of the common risk factor is imbalance in the muscle. So one of the things, even if you have inflammation in the knee and the ligament of the patella that causing this issue, I actually have the patient start to work on the hamstring, the IT band, the quad, to loosen up this muscle by breaking the scar tissue that's internally there and releasing the fascia. So that will decrease the stress on the knee ligament to decrease the pulling and on the inflamed area that cause the Osgood Schlatter. One of the reasons I want to cover the fascia system here, because it's overlooked by a lot of healthcare providers, and it actually has significant effect on Osgood Schlatter, and it's an important part of the treatment. So the fascia system is very complicated, but don't worry, the treatment is very simple. But I want you to appreciate the complexity of the fascia system. So fascia is the superficial layer. It's like a wrap surrounding the entire body. It's like a Spider-Man suit that's wrapping your entire body. And you can see it here in this image, the white web tissue. These are the fascia layer. And actually, when you buy a steak next time, you can see that white filament. Actually, that's the fascia layer. So we have a layer that's wrapping the entire body, and we have a layer that's wrapping a group of muscles called apparatic fascia. Then we have a layer, the epimysin, wrapping each individual muscle fiber. You can see it here. And then we have the premisin wrapping in the group of bundle of fibers, and at the end we have the endomyosin wrapping each individual muscle fiber. So why this is important? Because it's a very it's not possible with massage and foam roller to break the deep adhesion or get deep enough to release the fascia restriction. Think about this way: if you have a screw in your motor and the screwdriver is very short, it's impossible to really unscrew that screw. That's exactly what happened with massage and foam roller. If you cannot exert mechanical force on the fascia restricted area, it's impossible to release it, and that's why massage and foam roller do not work. To make things a little bit more complicated, each of those layers, the superficial and the deep apparatic fascia, and the aponeurosis and the epimysin, premisin, and endomyosin, has 1 to 2 sub layers of fascia that should be gliding on the top of each other. It's very important to understand the complexity of the fascia system, because that will make sense why massage and foam roller is not going to reach those layers to really do deep release. And if that does not happen, because a lot of the scarring is actually gluing or preventing the elasticity of the fascial layers to glide on the top of each other and make it adhere to each other, and that causes a lot of pain and restriction in the range of motion. So what should we do to release the fascia? What I personally do is I use the A1 to release the superficial and apparatic fascia, and then I use the A5 to release the epimyosin, premisin, and endomyosin. And that's why I said with massage it's impossible mechanically to go deep with the knuckle, so that's why I use the A5 for that, or the elbow, because it's very thick. That's not gonna get to the fascial layer to really exert mechanical force. So to sum it up, what should we do at home? Well, first you need to stop the repetitive motion that aggravate your symptoms, like a squatting, jumping, sport activity. We need to decrease the stress on those ligaments that are inflamed and scarred. The second thing, we need to work on the inflammation and proliferation simultaneously. You cannot pick and choose. I will use only the MagnaHeal to decrease the inflammation, but I'm not gonna release the scarring or the fascia restrictions. That's not gonna work. And it's not only the problem in the knee. You might visually see it in the kneecap or by the patella ligament, the inflammation and the scarring, but we have to release the hamstring, the IT band, the quad. We have to clear up everything to make sure that there is less stress on the knee ligament. And that's basically how to relieve Osgood Schlatter disease pain at home. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.